This presentation is on the LGBT community and substance use. LGBT stands for lesbian, gay, bisexual, and transgender. Here are some definitions of these words. Lesbian is a woman that is sexually attracted to another woman. Gay, a man who is sexually attracted to other men. Bisexual, someone who is attracted to both men and women. Transgender, someone who identifies with or expresses a gender different than the sex one has at birth. The LGBT community experiences discrimination and violence at immense rates. Until 1973, homosexuality was considered a mental illness. Though there have been advances in acceptance of the LGBT community, there is still a long way to go. Heterosexism is a prejudice or discrimination by heterosexuals against homosexuals. Homophobia is the fear or aversion of homosexuals and/or homosexuality. Heterosexism is known to cause internalized homophobia, negative self-concept, and shame. This often leads to substance use in order to cope with these negative feelings. "56% of gay people and 70% of transgender individuals have reported being discriminated against when they are trying to find housing. This is based on the sexual orientation and their gender identity. 43% of gay individuals and 90% of transgender individuals report harassment and discrimination while at the workplace. The heightened use of substances in comparison with the general population is staggering. 20 to 30% of the LGBT community abuses drugs, compared to 9% of the general population. Tobacco use is 200% more than the general population. 25% abuse alcohol, compared to only 5 to 10% of the general population. With this alcohol abuse, in this population, they are more likely to continue drinking until an older age and less likely to abstain from use. For lesbians, 30% of all lesbians have an alcohol abuse problem. Marijuana and cocaine has a higher usage rate for lesbian women than for heterosexual women. Gay men are 3.5 times as likely to use marijuana, 12.2 times more likely to use methamphetamines, 9.5 times more likely to use heroin, 21 times more likely to use nitrite inhalants, 4 to 7 times more likely to use hallucinogens, sedatives, stimulants, and tranquilizers. In a CDC study of gay youth ages 15 to 22, it is found that a third used methamphetamines, ecstasy, marijuana, or cocaine at least once per week, and their drug use was 3 times higher than the national sample. Their environment plays a factor in their substance use. Substance use, especially alcohol, is seen as a big part of social life in their community. The community is often surrounded by social gathering places such as bars and restaurants that promote the use of alcohol and illicit drugs. It has also been found that advertisers specifically target the LGBT community in order to sell drugs such as tobacco and alcohol. They'll use terms such as freedom, liberation, and independence, things that are important to the LGBT community, in order to sell these drugs to that population. Raves and parties are big in the LGBT community. Party or rave drugs like MDMA, ketamine, and GHB are on the rise at events. Meth Methamphetamines are also on the rise in this population. Treatment is often not sought due to mistrust and fear of not being accepted. This fear comes from constant discrimination in their lives, and they think that this will also translate in treatment. LGBT couples are often not treated with sensitivity. Thus, in treatment, the partner is not involved in the counseling as a heterosexual couple would be involved in the treatment plan. Treatment is often not tailored to the LGBT individuals, and it has been found to be more beneficial to the LGBT community that is suffering from substance abuse to have a program that is catered to them and to be in groups with like people. It is important to know the stage of the coming out process that the client is in so that the counselor will know what the client is comfortable talking about, because the client may not be at the point where they want to talk about their sexuality yet. Sometimes it is found that other issues have been in the forefront for counselors to focus on, rather than the actual substance abuse. Counselors may focus on things that are not important to the client, such as the client's sexuality, which does not need to be addressed in the treatment at times.